Good afternoon, I'm Deborah Knapp.
And I'm Aaron Wright. Bexar County is working to take proactive steps to improve the way mental health calls are handled here.
Eyewitness News reporter Jordan Foster explains how a new $1.5 million program should help.
After the Bexar County Sheriff's Office was criticized for its handling of previous mental health cases, most recently the killing of Damian Daniels, Bexar County Commissioners approved a pilot program to improve the way mental health calls are handled in the county.
SMART is a multi-disciplinary team, typically a three-person team that has, of course, a mental health deputy, specially trained, specially equipped.
The SMART team would consist of a mental health clinician, a peer support specialist, a paramedic, and a mental health law enforcement officers, all specially trained to deal with mental health calls.
I think it's very important to have the programs available and accessible.
Dr. Martha Livingston with the San Antonio Counseling and Behavior Center is happy with the county's $1.5 million program. When dealing with mental health cases previously, callers only had three options: police, fire, or EMS. This new SMART program now gives callers a fourth option, giving the caller a more specialized response while also allowing sheriff deputies to focus on other calls.
Between those three disciplines, they should be able to handle a vast array of services that would have been handled by a patrol deputy.
That training is happening right now, from dispatch to the team on the ground, and soon it'll be available 7 days a week for 16 hours each day.
I think a lot of training needs to be happening with some of the folks that are directly related and dealing with these individuals.
The SMART team had its very first call on Monday. They say that person was able to get the specialized help that was needed without incident. Jordan Foster, KENS 5, Eyewitness News.